I want to thank everyone for joining us here today. I'm joined by a number of important dignitaries in our community. We have Police Chief Bob Noble. We have President of the Yorktown Chamber of Commerce, Sergio Esposito. We have our Highway Superintendent, Dave Paganelli. We have our Councilman, Ed Lachterman, Councilman Vishnu Patel, and Superintendent of the Yorktown School District, Ron Hatter. We are expecting Superintendent Stone to join us as well, but due to time constraints, we're going to continue. As many of you know, both the Lakeland Central School District and Yorktown, here's Dr. Stone, right on time. Thank you, Dr. Stone. Please join us. Dr. Stone of the, it's okay, Dr. Stone of the Lakeland Central School District as well. As many of you know, both the Lakeland and Yorktown school districts are closed today. The town board supports and respects this decision, which we believe will ensure their students and staff remain in a safe environment. As of this morning, 11:30, when I talked to the county, there are 0 confirmed cases of COVID-19 in the town of Yorktown and in our local school communities. I do want to say, though, that information, as we've been seeing, continues to change rapidly. It's almost an hour-by-hour basis, but as of our last check-in with the county, we had 0 confirmed cases in the town of Yorktown. The steps taken by our school districts, as well as those by local government, are geared to minimize the impact that COVID-19 may have on our community. After careful deliberation, the town believes the best course of action is implementing social distancing practices, which means limiting the opportunity of people to assemble in large groups. Therefore, we've decided to take the following steps, which are being implemented immediately and started to be implemented as of last night. Our nutrition center will be closed until April 1st. Staff will be enhancing our Meals on Wheels program to deliver to seniors who rely on our services, and I do know that our director has already been in touch with our senior population and is coordinating that as we speak. All extracurricular activity at the Albert A. Cappellini Community and Cultural Center will be suspended until April 1st. And again, our staff already contacted a number of folks who have tried to rent space and have programming to cancel those events. Staff who enter occupied homes for inspections or repairs will only do so for emergencies until April 1st. That specifically is geared towards our building department and water department. The John C. Hart Library will limit its capacity during operating hours until April 1st. Our governmental meetings will continue to occur. However, all public hearings will be postponed until the month of April. And there are several planned events throughout the community which have also been canceled, and we can provide that information to the press as well. Since last month, I've participated in numerous conference calls and conversations with our partners in government on the local, county, state, and federal level. I really can't emphasize the importance of those conversations and the productivity of our partners in government. Yesterday, we convened a meeting here with members of our staff, local emergency responders, and our school superintendents from both Lakeland and Yorktown. We are clearly dealing with an unprecedented situation, but I have full confidence in our operation. Already in place here in town government, our building and maintenance staff have been cleaning twice a day, as well as wiping doorknobs, handrails, and light fixtures 4 times daily. It is important to emphasize that while we're encouraging social distancing, we're not suspending social interaction. Now more than ever, we should take advantage of modern technology, and we're live streaming right now on the town's Facebook page, but we should take advantage of modern technology to communicate and check in on our vulnerable neighbors and our loved ones. This is going to help prevent the rise of depression caused by social isolation, and it's also going to help us on the town level provide services to those in need. Should we reach a point where remote access is required, our finance department will continue to be able to process payroll and our purchase orders. Currently, if staff are healthy, they're expected to report to work here at the town of Yorktown. Should someone exhibit symptoms, stay home and seek medical attention, sick time will be appropriately used. As I said before, the situation is incredibly fluid. And frankly, like I said before, the word I keep using is unprecedented. This isn't your normal snowstorm. That's not what we're dealing with here. Information has changed several times and continues to change, making it that much harder to provide accurate material for dissemination. The town will remain proactive in communication with the public and transmit accurate and appropriate information to our staff. And I just want to, again, reemphasize our partnership with our school districts. We have been in constant, nearly hourly contact, especially this week as things transpired over in your individual districts. I want to personally thank County Executive George Latimer, whose staff has been tremendous, who's in sharing information, providing support, including, of course, Dr. Shalita Amler, who's the Commissioner of Health, and her staff. They have been very responsive to the town, to our questions, to our needs, and so I do want to thank and acknowledge them. With that being said, I want to see if Chief Noble, I know that you are in a bit of a time crunch. I want to see if you want to provide some additional information or thoughts regarding what our community is facing right now.
All right. Thank you, Supervisor. Good afternoon, everybody. As the Supervisor alluded to, these are unprecedented times, and it's something that is unusual. Having been at the forefront of the storm we faced about 2 years ago, where 90% of our town had no power, that's kind of a ground ball looking back on it with what we're facing now. But, you know, I talked to a lot of different people in the community, and there's two ways of looking at it. You have people who are just seeing the NBA cancel and March Madness played without fans, and they think it's a massive overreaction. It's not. This is how you stop the spread of this virus. And while 80 to 85% of us would be minimally impacted by this virus, there's that 15 to 20% of the population who have compromised immunities that could die from this disease. So that's why these things are being done. And then on the other end, you have people who are just panicked, fear. You spoke about depression, Supervisor, but you know what we're seeing over at the police department is people really worrying a little too much. There's good information out there. It's being shared daily on the town website and Facebook page. And the Yorktown Police Department, we posted an informational bulletin on our Facebook page. Good hygiene and good social practices. If you're not feeling well, you know, now's the time to really look out after everybody else and consider staying home and not mingling with people in maybe even a room like this or you know, anywhere out there. Make your decisions wisely. Is it a time where you should stop doing what you do in your normal daily activities? Oh, go to your delis, go to your bagel stores, go to your market to pick up what you need. But just be smart. Good hygiene and not overreacting. Smart and safe is what we like to call it at the police department. Since mid-February, we have had screening procedures in place that were given to us by the Westchester County Emergency Operations and the Health Department. We screen phone calls that show signs when we get an aided type call is what we call it, where somebody would call up for medical assistance, and we go on those calls because you never know when somebody's going to have cardiac arrest or the guys on the ambulance crews are going to need a hand. So we do respond to those calls. The screening procedures we have in place are to protect everybody responding to that call, as well as to provide information to the county health department, so that people who are people under advanced risk or I think they're under suspicion of having it. I don't know what the correct terminology is, but we want to make sure that those referrals are made to the health department so that they can track and hopefully test anybody who is presenting with the signs. So like I said, those procedures have been in place since mid-February. We have not had a positive incident where somebody has been infected with the coronavirus. Have we had calls that had us take additional steps and ask questions and make sure, everybody was protected and the person got the care they needed? Yes, but I'm confident with those screening procedures that we will be able to hopefully identify somebody who is presenting an increased risk for having this, and we'll be able to make those notifications, thereby keeping everybody safe. Because like I said, these particles, spread people's clothes. That's the clean down, the deep clean down that you're talking about, Supervisor. I mean, that's what we need to do these days. Be cognizant of hygiene. And like I said, don't overreact and be smart out there. Is there anything I'm leaving out here?
No, sir.
All right.
Nailed it.
Thank you.
Thank you. Appreciate that. I'm going to ask Dr. Stone and Dr. Hatter. Dr. Stone, if you wouldn't come say a few words, just give us an update from the Lakeland School District.
Thank you, Supervisor. As the Supervisor and the Chief have both said, talked about, as far as I'm concerned, the major thing that we can do to help people is communication. We've been putting out a daily posting, circulating through the entire district and Facebook. In fact, I think Tuesday's had 37,000 shares. So we are getting the message out there. I think that's the best thing we can do is to communicate to our community why we make the decisions we make with as much information as we can give. Folks have to understand in our business some of that information that involves children and families is confidential. So we try and share as much as we can share. We're trying to deal with all those issues. We're also dealing, obviously, aside from the health issue, we're also dealing with issues related to state regulations and state law in terms of days of instruction, state testing, regions testing, all of these questions that our communities have. We're trying to deal with all of those issues. Another issue, obviously, is we have so many of our children receive free and reduced lunch. So our food service supervisor has made application to the state to allow us to provide free meals to our, actually, we believe we may be able to do that to all of our student families. So we'll know more about that once we hear back from the state. We sympathize tremendously with our families that have to make arrangements for their children to be watched at home, for the financial imposition that is placing on our families. But as the supervisor and the chief have both said, health and safety are our number one concerns, and that has to take priority in all of the decisions that we make. In terms of our district, we did have a family on the Cortland side where there was a positive test for the virus with a family member. We're awaiting test results for the student who are in quarantine. So awaiting that, and out of an abundance of caution, we did close our schools Wednesday and today. Tomorrow is a superintendent conference day, which our teachers will be working from home. We have sanitized and disinfected our buildings from head to toe. We want to thank our neighbors in Yorktown for sharing their larger sanitizing machines. We have 10 on order, but like everything else in the health care industry, it takes longer than what they promise. They're supposed to be here next week, and we'll be happy to share those machines with the town or any other of our neighboring districts that would need those. So as soon as we're ready to come back to school, our schools will be clean and ready for students. But again, we're in a holding pattern at the moment, and hopefully now that we have 3 or 4 days until Monday, we'll be able to make some concrete decisions on where we are next week.
Thank you.
Okay? Thank you.
Thank you, Superintendent. Superintendent Hatter, do you want to just say a few words about Yorktown and what's the situation in Yorktown right now for the school district?
Thank you, Supervisor Slater, for inviting us here today. I really appreciate the partnership that you've extended to us. With regard to the Yorktown Central School District, the district was closed today, given some of the cases that were in neighboring communities and some of the tangential connections that were to our district and to our families and to staff. We thought it prudent to leverage the professional development day tomorrow, where no students were scheduled to be in anyway, and create 4 days of social distancing within our school community. So I do want to share some of the proactive steps that school districts are taking to ensure the safety and health of your children. Ultimately, you entrust us with your most precious assets, your children, and we take that very seriously. And it's a responsibility that we meet with great honor. I'll share with you that we began our disinfection schedule back on January 6th. This was to combat the spread of influenza. All areas within our schools were on a weekly disinfection schedule at that point, which was a very aggressive approach. And then as COVID-19 came to the forefront after our February recess on February 24th, we actually started a daily disinfection schedule of all spaces in our schools. That is the most aggressive step that a school district can take, and that's thanks in large part to some of the more advanced cleaning technology that we have that allows us to disinfect an entire classroom or any other office space or communal space in a very short amount of time. We've built in hand washing breaks at the elementary schools. We've installed more hand sanitizer stations. We have begun a disinfection schedule for our school buses. Although our buses are not owned by the district, our contractor has agreed to put our school buses on a weekly disinfection schedule. We are taking so many proactive steps within our school community because we understand how important it is to maintain the health and wellness of the 3,400 students in our district, the 500 staff members that we have. Ultimately, with 4,000 people coming together every day, things can change and
Right.
situations shift, and circumstances certainly adapt on a moment's notice, or even without notice at times. I do want to assure our viewing public that we are in constant communication with the Westchester County Department of Health, the New York State Department of Health, our medical director, and these conversations are happening multiple times daily. They're the medical professionals. We defer to them. We yield to them. They have an opinion and an expertise that we rely upon to make some of these decisions, such as the decision to close schools today. So we'll continue to be in communication. I encourage you to visit the Yorktown Central School District website. There is a devoted coronavirus page that has the 7 different community letters that I have sent out on this topic. So if anyone is interested in accessing those resources, they're available to you, as well as a video on hand washing. That's where a lot of this starts.
Yep.
Especially working with young children, I do encourage our families to really emphasize the importance of hand washing and good hand washing and getting the fingertips and trying to really have that hand washing experience go for a full 20 seconds, because quite often children are in a rush to just wash their hands and get back to whatever task they were interrupted for that hand washing. So with that said, Supervisor, thank you so much for your support, and thank you to the town for all of the support that you have been throughout this process and that you'll continue to be.
Absolutely. Thank you, Superintendent. Councilman Patel, would you like to say a few words?
The health is a wealth. This is being said. This is a worldwide problem. Our supervisor, the board member, and police department, and our school superintendents, they are all together to sharing our grief, and sorrow comes out of there. We are going to fight, and we're going to come out stronger than we are today.
Perfect. Thank you. Councilman Lackerman?
Just to reiterate, this all starts from your universal precautions, your hand washing, sanitizing, staying home if you don't feel well. I'm daily in touch on my business side with healthcare professionals daily about this. We really just need to practice the 20-minute hand washing. In the restaurant industry, the old adage used to be sing happy birthday to yourself. We find that sometimes people go through it pretty quick, so we're recommending sing it twice, just to give yourself an idea of how long that time is, and make sure that you really wash thoroughly, fingertips all over, sneezing, coughing into the crook of your arm or your hand, and then immediately washing and sanitizing afterwards. Just all basic universal precaution steps. They go a long way to keep us safe, and we just pray for everyone, and we know that we will get past this with the steps taken, and hope that no one is affected too seriously in our community.
Thank you, Councilman. And Highway Superintendent Paganelli, I know you want to say a
Thank
few
you.
words as well.
Yes, I'm proud that for weeks now we've been working behind the scenes to ensure that essential services will be provided to our residents. That includes sewer, water, refuse, nutrition, particularly with the nutrition center closed, in order to have order, Highway Department, as with any weather-related emergencies, will take control of the labor force and will delegate and allocate as necessary to, bear in mind that town employees are not immune from the virus. So should there be situations where town employees are infected, we will then continue to shift and allocate in order to be able to provide the essential services that are necessary. Thank you.
Thank you very much. And I also want to ask our Chamber President, Sergio Esposito, would you like to say a few words? Yes, sir.
Mr. Supervisor, thank you for inviting us today, inviting the business community. We really appreciate it. The Yorktown Chamber of Commerce is in full support of the decisions that our town officials, school officials, highway department, first responders, and our police department have made to date. These decisions have been prudently cautious and pragmatically, they are the right thing to do. For our local businesses, the Chamber is closely monitoring the proposed tax relief incentives that will be working their way through the Congress, and will provide info to our business community as it becomes available. From the Yorktown Chamber's perspective, it is important to note that we should all limit large social gatherings for at least the next couple of weeks as our government works to contain this outbreak. As you could see, all the officials up here today, they're in unison with conquering this battle, and we will, as our Councilman Patel has stated, succeed. I also would like to note that it is still relatively safe in Yorktown. So if you need groceries or if you're looking for something to eat, our local businesses stand at the ready to serve you in the safest possible way. Thank you.
Thank you very much, Sergio. With that being said, I just want to reemphasize one more time. There's a big difference between being proactive and panic. What you're seeing here in the town of Yorktown is being proactive. We are confident in our operation. We continue to communicate, again, nearly hourly, depending on the time of day. And we are here to serve the residents and assure the residents that we have an operation that we are confident in and is ready to deploy should we need be. So with that being said, I'm willing to answer any questions from the press. If you have any questions for anyone up here, yes.
I have a question for Dr. Stone.
Doc, why don't you come over here so we can get you.
Can you start the disinfecting schedule for the Lakeland schools as with the Yorktown Supervisor? Do you have a
Yes, it's very similar. Everything is disinfected and wiped down and daily. The buses as well now. With these machines that will be here Monday, we'll be doing able to do everything very quickly, and that will be daily as well.
And are there additional hand sanitizers?
There have been, yes. In fact,
They've been installed in classrooms?
I'm not sure whether they're in individual classrooms. I know that in our building alone, 10 have appeared up and down the hall, so I know that the schools were the first priority. So I know that sanitizers were put up everywhere, close, if not close to all classrooms.
And for both of the superintendents, do you see any impact on athletic schedules going forward?
Definitely.
Just the question was impact on athletic schedules because she doesn't have a microphone.
Yes, the question was, will there be an impact on athletic schedules? And obviously, teams are required to have so many practice days prior to competing. Section 1 is taking all of this under consideration and looking at whether the schedules will need to be modified, and we'll keep you up to date on that as well. Not to my knowledge.
No, I think there's an inevitability. And just to clarify, our hand sanitizing stations are throughout the buildings as well. Every classroom does not have a hand sanitizing device dispenser. With regard to the impact on spring athletics, there are a couple of schools of thought and a couple of factors at play. Generally, spring athletics are played outside, open airs. Crowds are not very large. However, when a school closure is initiated, all activities associated with the school closure are also canceled. So minimum practice requirements may not necessarily be met. So while no formal decision has been issued from Section 1, there is going to inevitably be an impact as more positive cases emerge in the region and districts have to call off school. Inherent in that closure is a cancellation of athletic activities.
Right. And for the town, our rec department and our rec programs have also, our indoor rec programs have all been suspended. The SOAC basketball season, I know we have the play-by-play announcer over here, Chief Noble, but that end of the season has been postponed right now until April for their basketball season. We're just trying to, again, proactively limit the congregating of a large number of people in these indoor facilities. And so we've taken the same steps. YAC is canceling some of their indoor programming as well. They had some clinics that were scheduled. I've been in touch personally with both the president of YAC and SOAC, our Shrub Oak Athletic Club, and they're following suit. And also this morning I was with our interfaith community, informing them of the decisions made by the town and the schools, and they're making their decisions as well. Obviously, we can't mandate them to stop holding services or programming, but they are well aware of the situation. They're well aware of where the town stands, and I think many are actively exploring what options they have before them to make sure that their congregations are properly cared for but safe.
Can you spell out the limiting the capacity for the library?
Right now, it's 30 people at a time. We're not allowing more than 30 people at a time in the John C. Hart Library. Any questions for Chief Noble before he scoots? Because he does have a very busy day. No?
You ask a lot of questions. Usually I'm the guy asking questions.
Just out of curiosity, we'd love to do one-on-one.
Yeah, we'll get you one-on-ones.
Dr. Hatter and Dr. Stone, if that's okay?
Yeah, I have a
If you guys want,
2:15 timeline, but we're good right
So
now.
do we. I mean,
yeah, we can. Yeah, so we'll have this be our last question, then you can take them for stands.
I'm just curious, do you have a big idea or a more specific idea of how many calls you've been getting over the last week or so that, from people that are concerned or panicked or do you have any?
The question was, do I have an idea of how many calls we've received regarding residents who are panicked and concerned? I would say not an overabundance, really. I think, you know what, Yorktown, I mean, in my experience, and I love this town, I mean, the residents here are tried and true, man. They're battle tested, a lot of them. We're getting a few new ones from the city, and but they're catching on. But I hope when they see what you see behind you and the collective efforts that we make, that, you know what, that's why you move to a town like this, because of the services and the attention that you get. So I don't have a hard count, but we're open 24/7. If anybody's concerned or scared, they can always call my police department.
Thank you, Chief.
Thank you,
And just
Supervisor.
again, because we are putting this on the public access channel, if anyone does have any specific questions, 211, the county is coordinating with the United Way of Westchester Putnam, so they can just call 211 with any COVID-19 specific questions or concerns. The number here at Town Hall, 914-962-5722. And you can dial either extension 201 or 200 to get to the supervisor's office. And you can email me directly at mslater@yorktownny.org. And again, I want to thank everyone here for your partnership and leadership. I also, once again, want to thank County Executive Latimer for all he's done for our community and continues to do. And with that being said, we appreciate everyone's time. And please just stay healthy, be smart, and we'll see everyone soon. Thank you.